In this video, we're going to be talking about keratoconus. What is it? How does it affect your eyes? And what can you do about it? So, by definition, keratoconus is what happens when the cornea, the tissue in the front of the eyeball that's kind of like a clear dome structure which light passes through, what happens is one of the layers of the cornea affects several layers of the cornea. And in this case, Bowman's membrane. So you got the epithelium up top, you got Bowman's membrane right underneath that. It bulges out and becomes more like a cone, like a traffic cone, or even an ice cream cone for that matter, where it just kind of bulges and kind of comes to a point, basically. This can be genetically driven. It can be due to an injury or an accident. It could be even due to rubbing your eyes too hard, honestly. And a lot of times it comes about in a patient's later teens, early 20s, from what I've typically seen and diagnosed it, but it can happen at any point in someone's life. And it can devastate the vision significantly to increase the amount of astigmatism, chromatic aberrations, everything that kind of distorts the vision to make it double, make it hazy, make it blurry, make it not great for your eyes, honestly. We see a lot of it, and there's enough diagnoses out there to where a lot of times probably the primary reason it can happen is genetics, followed by the eye rubbing, followed by injury related incidences, whether it's a car accident or punch in the face or anything like that. What can be done is to make sure that you talk with your local optometrist or ophthalmologist to see if there's any surgical options you need to do in order to consider slowing down the progression of it, because there are laser procedures, there are surgical procedures that can slow down the progression of keratoconus. It can't necessarily reverse it at this time of the making of this video, but it can slow down the progression of it. Specifically, whenever we talk about corneal cross-linking, you may see it in some literature as CXL, but basically, it's a laser that superheats the cornea and kind of like tightening leather to a belt and superheating that leather on a belt that you would wear around your pants. That's what happens whenever we try to heat, or at least when the surgeons try to heat the cornea up to slow down the progression of keratoconus. And there's a couple of things you can do in order to get the vision sustained and actually seeing great. If it's not correctable in glasses, because sometimes the astigmatism is just too thick for the glasses prescription to be made correctly, another thing you could consider is something called scleral contact lenses. And previously, as a precursor to scleral contact lenses, we used to do some things like gas permeable contact lenses, PMMA contact lenses. They're the small, really hard contact lenses. But technology has advanced significantly in the laboratory manufacturing realm that I've done probably dozens of these, honestly, that these scleral lenses are kind of a larger version of it, basically. And what happens with it is we fit the scleral lens to the patient's eye, and it bypasses the amount of irregular astigmatism that exists on the cornea and allows someone to see clearly through that hard contact lens. So in a few moments, you're about to see what a gas permeable or a small hard contact lens looks like. And when we fit this to the patient's eyes, we work with the laboratory in order to be able to make sure it fits correctly and that the patient can see correctly. But if you kind of look at this, it's this tiny little contact lens right here. That's what a small gas permeable hard contact lens looks like. That was what was done first in order to help the patient see better when it's not correctable in glasses for the most part. Now, as technology and time has changed and things have gotten a lot better in the management of keratoconus and other corneal dystrophies, ectasias, different things that can kind of mess the vision up significantly, but in this case, keratoconus, this is the next thing we can do, and that has actually provided a substantial amount of vision correction changes. So this is what we call a semiscleral contact lens. Basically, it vaults the entire cornea, lands on the white portion of your eye known as the sclera all the way around, and acts basically like a cornea to correct for the amount of irregular astigmatism that exists. You've got a gas permeable small hard contact lens over here, and you've got a semiscleral contact lens, still hard material, over here as well too. And there's some very dramatic differences in the way that these two are shaped. If those options aren't as viable, and if they're not great to the patient's vision, and there needs to be further surgical consultation or things other than just hard contact lenses that need to be considered, make sure you work with your local eye care professional, and they'll get you to the right specialist that needs to see you in order to get your vision stable, to get it healthy, and to be able to make sure you can see your best. Keratoconus can actually be managed very well, and patients can go on living an exceedingly healthy life without it being a detriment to their vision as long as it's managed appropriately. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications and to learn more about your eyes. I'm Dr. Bryce Heffington. We'll see you next time.